Morning, I am Dr. Malik, intensive care specialist. Today I want to talk about an important topic. Recently, for the last 1 week, we got three patients, all are between 40 and 50 years of age. Two females and one male, all are between 40 and 50. They are known diabetics. They have diabetes. All the relatives told us that they are diabetics, but they don't have hypertension. They don't have BP. That's what they feel. They don't have hypertension from the beginning. They are diabetics. They are controlling diabetes. That's what they said. But all the three patients, they came to us. They came to the ICU in a state of breathlessness. They came with breathlessness, difficulty to breathe, and inability, and their oxygen levels are coming down. So out of three patients, two patients we had to put them on ventilator because the lungs were full of water. That is, they were in cardiac failure. The patients were in cardiac failure. So how come this cardiac failure came? Where come this cardiac failure came? Immediately we one patient didn't need ventilator. The other two patients needed ventilator because the oxygen saturation is falling. It is coming below 80. So naturally, SpO2. There is a small probe we used to use in COVID time. If it shows, if it is going below 85 or something, we have to put him first. We'll put oxygen. If necessary, we'll go for ventilator. So the lungs were full of water. What exactly happened? How these people landed in cardiac failure? The thing is, when we tested them, when we did a 2D echo, first we called the cardiologist. We have done a 2D echo. 2D echo means a scanning of the heart. He has done. Usually there is one thing in 2D echo. There is one particular thing called ejection fraction. Ejection fraction is a parameter which should be between 60 and 70 in normal patients. In normal patients, it is between 60 and 70. But in these patients, it is 30, 31, 32, like that. That means the heart is unable to pump. The heart is not able to pump. That means it is in failure. The heart is in failure. And number two, when I have tested their blood for serum creatinine, for kidney, they were all having 3.5, 4, 4.1, like that. So serum creatinine has gone up. That means they have kidney failure, which they didn't recognize. They have kidney failure, which they didn't recognize. Okay, over some period they have kidney failure. All of them, they have pedal edema. That means edema in the feet. They were pale. All the three patients were having paler. One person had 4 grams, one person had 6 grams, the other person had 5.5 grams hemoglobin. So their hemoglobin is also low. So low hemoglobin, paler, and breathlessness, and pedal edema. Low hemoglobin, foot edema. There is water in the feet, and the puffiness of face, and one more thing is they were all breathless. So all these things, they say that number one, the ejection fraction is 30%. That means there is cardiac failure, and 3.5 is serum creatinine, 3.5, 4, 4.1. So in all the three conditions, I am three patients. So the maximum allowed is 1.4 only serum creatinine. It is 3.5, almost double, triple. So the patients are having renal failure, kidney failure. And one more thing is the potassium, serum electrolytes. The potassium in these three patients is, one patient is having 5.7, the other one is having 6, the other one was having 6.3. So potassium is very high. Potassium should be between 3.5 and 5.3. I think nowadays actually 5.5, but nowadays they have reduced it 5.3. So anything above 5.5, we call it as high potassium. They are having 6.5. So they were having cardiac failure. So how this cardiac failure came? They don't know. They don't know that they had renal failure. These patients, the number one reason for kidney failure is diabetes. Second one is hypertension, BP. But these patients, they say that they don't have hypertension. So how hypertension came? How high BP came? First, these patients had diabetes. They were not really controlling the diabetes. So slowly there is kidney damage. Slowly there is kidney damage. So because the kidney got damaged, slowly once the kidney damage is there, you will develop hypertension. High BP will be because of kidney damage. So because I will tell you what exactly kidney will do. Kidney means not single kidney here, both the kidneys. Renal failure, kidney failure means both the kidneys. Remember, it is not single kidney, both the kidneys. Only when two kidneys, both the kidneys fail, then only the serum creatinine will go up. Otherwise, it will not go up. So what exactly the kidney will do? The kidneys, they will maintain the acid-base balance. They will maintain the pH of our blood at 7.3 to 7.4. Number two, they will take out the water from our body. So if the kidneys are failed, water will remain in the body. Water will be there in the body. And electrolytes, they will maintain the electrolyte balance, sodium, potassium, chloride, etc. Once the kidney damage is there, you have seen potassium has gone up. So toxins, the kidneys, they eliminate toxins from the body. They take out toxins from the body like blood, in the blood, urea, nitrogen, creatinine, etc. Toxins they take out from the blood. But here they are all retained in the blood because of failure. So BP is well maintained by the kidneys because of some hormones produced in the kidneys. And erythropoietin is one substance which is produced in the kidney which manufactures red blood cells. So the hemoglobin is also low. Once kidneys are not functioning well, the hemoglobin also, the red blood cells also will go down, and hemoglobin also will come down. So lastly, vitamin D, it activates kidneys. They help in activation of vitamin D. So all the physicians, whenever there is some doubtful kidney function, they first put you on vitamin D. Vitamin D once in a week, they put it like that. Once the kidney is not functioning well, because kidney is very important in activation of vitamin D. So in these three patients, what exactly happened is they had high sugar levels, uncontrolled sugar, and because of high sugar they went into renal failure, kidney failure, both the kidneys. So kidney failure means both the kidneys, and because of kidney failure there was high rise in BP. BP was also 170 by 120, like that, 110, 170 by 110, 180 by 110, like that in all the three patients. Next, because of this high BP and water retention, water is retained in the body, it is not going out, and electrolyte potassium is high. All these factors caused cardiac failure. So cardiac failure also, it is not in one day, it is slowly over a period of time. They had these problems over a period of time, they neglected and ultimately landed in this situation. High sugar levels leading to renal kidney failure leading to heart failure. This is the situation. So these are the sequence of events. That's why please, whenever, if you are a diabetic or a hypertensive, just please, number one reason for renal failure is diabetes, and number two reason for kidney failure is hypertension. So please always control the diabetes, and at least once in 6 months try to check the serum creatinine. Which should be below 1.4, and this is very, very important. So if you have any edema in the feet, if the feet are swollen, occasionally they are getting swelling, and if you feel weak, or if the hemoglobin comes down. So once you have any of these symptoms, please check the serum creatinine. And if there is some breathlessness, etc., get a 2D echo of the chest, of the heart done. 2D echo is very, very important. So see, if you are a diabetic, be aware of these small things. First, control your diabetes. Frequently check your BP, and at least every 6 months try to check your serum creatinine, which should be below 1.4. Just be vigilant. When you are hypertensive and you are a diabetic, you must look after these small things. Check your diabetes, keep it under control. Look for your hypertension, which is it under control or not. If you have any other doubts, like you have some feet water or there is some pallor, you have some weakness, please try to check serum creatinine so that you can prevent these complications. Diabetes to renal failure, diabetes to kidney failure to heart failure. This is a vicious cycle. Please try to prevent it and be careful. Be just vigilant. Check frequently. That is the only